Hi, I'm Matt Ellefson, founder and CEO of Survive It, and welcome to Fearless Friday. Receiving a cancer diagnosis and facing cancer is very difficult. Nobody will argue that. And none of us are ever prepared. And most of us don't have a clue where to start. Today I'm going to talk a little bit about what's most important in those first few days after receiving a cancer diagnosis and in facing the disease and living with cancer into long-term survivorship. When we receive a cancer diagnosis, it's because our body is broken and in need of repair. And because we're not doctors ourselves, we need the help of medical professionals to treat us of our cancer and put us into long-term survivorship. And the single most important thing to remember is that this is your life. Take charge, take control, become engaged in the process of treating and healing your body. Nobody has more at stake in this process than you. Not the oncologists, not the nurses, not the medical team, not your family, not your friends. Nobody has more at stake than you. And this is your life. And you really need to take it very, very serious and not assume anything for granted or assume that everything possible is being done for you. As a patient and long-term survivor myself, I've learned that this is my job, not somebody else's. Now, I'm not saying that your medical team is not looking out for your best interest. I'm not saying that at all, because in most cases they are. But they have a very, very difficult job, and it's very important for you to become engaged in this process as quickly as possible. You need to attack this as a team, together, with your oncologist and your medical team. And we've put a document together called 21 Questions to Ask Your Oncologist. It's free and downloadable at surviveit.org and in the link provided below. Please print that out and bring it to your next appointment. It's very important to have this detailed of a conversation and discussion with your oncologist in order to put yourself in more control of your situation. And don't forget, as smart as your doctor may appear, and as kind of a person that he or she may be, they're human beings just like you and I. They make mistakes, they have a busy job, and they oftentimes have a very busy family life at home. Their kids are playing soccer together with your kids. Their daughters are involved in school activities with your daughters. And hopefully you see them and their family at your church that you go to with your family. They're human beings just like me and you. And human beings aren't perfect, so don't assume they are. Another thing I'd like to point out is oncology is one of the most stressful of all medical specialties and at the highest risk for burnout. To be an oncologist and trying to keep up with the latest advancements in cancer care is virtually impossible. And the stress from that, together with repeatedly breaking bad news to patients, creates a very challenging occupation. In addition to managing very complicated situations, oncologists also are often faced with encounters from angry patients or angry families. So it's a really difficult job for them. And I'm not trying to put a negative light on oncologists in any way. I'm just keeping it real, like I do with all my talks. I want to tell you like it is. We need oncologists, and we need to have faith in what they're doing, and faith in knowing that we are receiving the very best in cancer care. And the only way we will know that is by asking lots of questions and becoming very engaged in our treatment process. There are many studies out there that show that patients who are engaged in their treatment process find better care, face their disease with less fear, and have better outcomes. And the work that Survive It does is focused on the patient and helping them receive better outcomes. If you have any questions at all or need any help in any way, you can always contact us by email at info@surviveit.org. I'm Matt Ellefson, and until next time, stay strong and live fearless.